The next topic we're going to cover is typhus. And typhus is a group of infectious diseases that are caused by Rickettsia bacteria. And we're also going to cover spotted fever or Rocky Mountain spotted fever, which is caused by another Rickettsia. So these bacteria are from the genus Rickettsia. And the most notable thing about them, well, there are two things. One is they are closely related to mitochondria. So if you look at the DNA inside of mitochondria, it looks very similar to the DNA inside Rickettsias. And the other thing is Rickettsias have to live inside our own cellular cytoplasm. So they won't grow outside of our cells, which is also kind of like mitochondria. And the Ricketsias, because of that, if they cause infections and they cause diseases, it's sort of like, we could think of them like a virus where their tissue tropism, or the cells they are able to infect, kind of determine the course of disease. So one last thing on this slide is this word obligate. So obligate is a word that confuses a lot of students because the only time you've seen it is with oxygen relationships. But that word itself has nothing to do with oxygen. You should think of obligate as meaning needs or requires or needing. So obligate intracellular means needing intracellular. So needs to be intracellular. And obligate aerobe would be needs oxygen, and obligate anaerobe would be needs a lack of oxygen. So there you have that. So the first of these diseases we will see is the big one is epidemic typhus, which is spread by body lice. And because of this, it is also called louse-borne typhus. This is one that has been well known throughout history, but is not as common in industrialized countries now. It's caused by Rickettsia prowazekii. And it is, like I said, spread by lice. And what happens, and these are not hair lice, not head lice, these are body lice. And so most of us have never had body lice. Body lice spread when people don't have access to hygiene. If you're something like a prisoner of war and you can't ever change your clothes, or you can't shower, that's when body lice will tend to live in a person's clothes. And the body lice grow Rickettsias in their gut, and they defecate as they bite, and they introduce the bacteria into our bloodstream. And the Rickettsia grow in our endothelial cells. And so that leads to some of the things we notice, like hemorrhaging of the small vessels. And so we will see epidemic typhus whenever the conditions are right for body lice to be common. So during wartime, in refugee camps and in concentration camps, situations no one ever wants to be in, but people are in now. We have refugee camps all over the world, millions of people in these conditions, and they are at risk of this. This was a disease that was widely feared during the World Wars. It's the disease that killed Anne Frank and her family, if you know who they are. It seems to have killed the majority of Napoleon's soldiers and changed the course of history in that way. And the way people are exposed to it now is kind of strange, but the body lice that infect us also infect, or I shouldn't say infect, they don't grow in us, but they prey upon us. They also prey upon flying squirrels. And so people who have exposure to flying squirrel nests have exposure to body lice. And people in the US have gotten epidemic typhus from flying squirrels before. Let's see. So the main unusual thing about this would be the unbearable headache, and then the rest of things would come from damage to the blood vessels and bacteria in the bloodstream and the immune response to that. Let's see. Okay, so that's epidemic typhus. Clinicians, we cross our fingers and hope that we never see that here. Endemic typhus, or flea-borne typhus, is more common, but still not particularly common, and it's not as dangerous. So this will happen whenever people are around mice and rats, and exposed to the fleas on the mice and rats. So again, not many people are exposed to fleas. During World War II, and this is a slide you can skip if you want to, this person was Wacław Szabalski. He was in Poland working on a vaccine for epidemic typhus. So epidemic typhus was killing a lot of people during World War II, and they were working on a vaccine. And in order to grow the Rickettsia bacteria that they were working with, they had to use body lice. They couldn't grow these in any other animals, so they would have to raise body lice. And the only thing body lice eat is human blood. And so this person has an amazing life story. And in Poland, people like him who had been educated and were chemists and physicists were being kind of hunted. And one reason they were allowed to live is because they were working on this vaccine. And so he helped organize people to feed body lice. And they would sit around a table playing cards and talking while these little boxes strapped to their legs full of lice would bite them. And one reason I bring him up is that he was doing research at the University of Wisconsin when I was there doing my PhD, and he came to some of my research talks. I was shocked because no one knew this story, but he came up and told me about it after a talk I gave because he was interested in the interaction between bacteria and the insect that I was working on. So his is kind of an amazing story because, like I said, he did research starting in the 1940s and kept going through the 20-teens. Okay, so then the last of these rickettsial diseases is spotted fever. And I've heard it called Rocky Mountain spotted fever. But it occurs everywhere, not just the Rocky Mountains. So it's better to remove the Rocky Mountains from its name. So this is the tick-borne rickettsial disease. We had louse-borne typhus, we had flea-borne typhus, and now we have tick-borne spotted fever. And this is caused by Rickettsia rickettsii. Let's see. It causes this distinctive rash, which starts on the extremities, like the hands and feet, and then grows towards the body, and that is distinctive. So if a person gets these spots that change from pink to red to dark red, and they appear in the hands and feet, and then slowly move up the limbs in a proximal direction towards the trunk, that's a strong sign of the spotted fever. And spotted fever is dangerous. A significant fraction, something like 5% of people who get it die from it. And it's hard to treat because it's a rickettsial disease. The only antibiotics that work for it are the ones that can penetrate our own cells. So the tetracyclines, for example. And so if somebody wandered into your clinic and the local physician gave them a broad spectrum antibiotic from the cephalosporins, for example, which is usually not a bad idea, in this case, it would not be effective. They would have to know what they're looking at and use a tetracycline instead. And I remember the very first time I taught microbiology, some of my students watched a reality TV show about infectious diseases, and they were horrified to watch an episode in which a patient came in with spotted fever and the doctors didn't know what it was and gave the wrong antibiotic, and the patient died. And they were very upset to watch this happen. So never let this happen. So anyway, this happens all over the US, and we can be exposed to it. Okay, well, that is it for the bacterial diseases of the cardiovascular and lymphatic systems. The next video, we will jump into the viral diseases of the cardiovascular and lymphatic systems. So I'll see you there.